Everybody. It's been a little while since we had one of these roundtables, so thanks for joining us today. We're back into session in the legislature a couple of weeks in, and we've got a few more weeks to go. But I believe the bulk of our legislation has already been introduced. So I'll tell you about a few of the things that we've been doing. Our first bill, Bill 1, was the Alberta Taxpayer Protection Act, which we already have in place. It's an amendment to it where you cannot have a sales tax in our province unless it goes to a referendum. So this adds to that. So you cannot increase personal and corporate income taxes without it going to a referendum of the people. We feel this is the right approach to let people know that we are going to be business friendly and pro-growth, and that when you come to Alberta, the only place your taxes are going to go is down, they won't go up. So we are hoping that provides some business certainty. And the nice part about taking this approach is we've already demonstrated that by having lower tax rates, we can actually increase tax revenue. We now have the highest level of corporate income taxes in our history, because when you have low taxes and you create stability, more people want to move to your jurisdiction. So we're hoping that we'll be able to create the same approach with personal income taxes as well. We also introduced Bill 2, which is our Alberta Pension Protection Act. I think there was a lot of mistruths that were said during the campaign. I think our opposition terrified a lot of seniors into thinking that their pension was going to be taken away from them, and that's not fair and it's not right. So we wanted to make sure that people understood that even though we are having this discussion about having an Alberta pension plan, that seniors are protected. Number one, the bill says that the only way we would have a Alberta pension is if the benefits paid to seniors were the same or better. The premiums have to be the same or lower. The 100% of the assets that are transferred would have to go for the purpose of supporting the pension plan, could not be used for any other reason. And ultimately, it will be up to Albertans to decide. If they choose that they want us to go to a referendum, we'll put it to a referendum of the people. So that was Bill 2. I know that there are many questions on the pension plan. Happy to answer those when we get to it. But we wanted to make sure that we cleared up any misinformation so that seniors know that they have no reason to fear. If there is an Alberta pension, they will be equal or better off under an Alberta pension plan. We also created an independent we also have a new approach that we're taking to Alberta Health Services. I think a lot of people have been frustrated at Alberta Health Services over the last number of years and the underperformance, even though we are one of the most costly systems in not only the world, but one of the most costly provincial health systems in the country. And we're just not getting the same results. We think it's a problem of structure. So we are refocusing the health system. So Alberta Health Services will be refocused on being a service provider, principally of acute care services in hospital. We'll have a separate organization responsible for optimizing primary care, another body that will be optimizing continuing care in nursing homes, and another that will be optimizing the care in mental health and addiction. And so those are in the process of being built out. But what we are hoping to have is a starting point being this, that every single Albertan should have access to a family practitioner, whether that is a doctor or whether it is a nurse practitioner. We're allowing nurse practitioners to be able to set up practices and bill the province directly. So that's one piece, to make sure everybody has good primary care. The second piece is on continuing care. We believe people should be able to age in place for as long as they choose. So that means more investment will happen in home care. We'll have more independent and assisted living and long-term care where people would be able to age in place. And we want to make sure that we have a very strong focus on keeping people out of hospital so they can have a more home-like environment in how they receive their care. The third aspect is mental health and addiction. We've seen a lot of our hospitals are being overwhelmed by people who are suffering from mental health and addiction crisis. We need to create a new avenue for those people to be treated in a proper environment. That's the approach we're taking with our recovery-oriented system of care. It's the reason why we're building specialized facilities, the first one in Red Deer, second one in Lethbridge, but we've got 11 in total. We're building specialized care facilities for mental health 5 of them. And we also have same-day counseling available through our 211 line, same-day virtual opioid dependency program, access to get a replacement for opioids. So we have a holistic approach on mental health and addiction, and that is going to be refocused. So there'll be more to say on that as we go forward, but we just installed a new Alberta Health Services Advisory Board. There's been some major changes in the executive leadership that were announced yesterday. We're going to bring in the right people to be able to help us achieve the targets that we've outlined there. The other report that was released this past week was an expert panel that reviewed the legislation and governance practices during the COVID pandemic to make sure that in the next public health emergency that we have an approach that does a better balance between taking care of the most vulnerable, protecting the healthcare system, but also protecting children's ability to get to have access to education, as well as the people's rights to be able to continue working and running their businesses. So we'll be looking at those proposals and see if there is any additional legislation that needs to be changed to support that. I wanted to thank Preston Manning and the panel for its work on that. The last thing is our relationship with the federal government. We have always asserted that the federal government is acting in a lawless way, that the way our country is supposed to work is that as a province, we are not a subordinate level of government to the federal government. We have our own area of jurisdiction, and the federal government has not respected that. We've had 2 court victories that have affirmed that. First, with the Impact Assessment Act, it was known as Bill C-69. The Supreme Court just told the federal government that it was unconstitutional and needed to be rewritten. So that was a victory for us. And then the second decision just came down this week, and it said that their approach to regulating manufactured single-use plastic products and declaring them toxic was also unreasonable and unconstitutional. And they will also been urged to rewrite their legislation on that front as well. So we're going to continue to be pressing for the federal government to stay in its own lane and take care of its own business. The next big battle that we are fighting with them is over a net zero power grid. We want to reduce emissions, but we believe we should reduce them to be carbon neutral by 2050, not 2035. We know that we're facing an affordability crisis, that the energy costs are a big reason for that. And we believe that having a reliable and affordable grid should be our principal objective as we reduce emissions over a more reasonable period of time. I can tell you that the Canadian premiers met in Halifax recently to discuss healthcare, along with our shared frustration with the federal government. You may have seen that we signed a joint letter with all of the premiers saying that we need to have tax fairness when it comes to the carbon tax and how it's applied to home heating. They have not responded to our call for that, but it is encouraging to me that all of the premiers, regardless of their political stripe, are very frustrated at the approach that the federal government is taking, that is attempting to divide and create regional disparities. So the fact that the premiers are urging the federal government to be fair about how they apply their laws, I think is a really important step forward. So there's much more we can talk about, but I'll leave it to you to ask the questions, and I'm looking forward to our roundtable. Back to you, Sam.
Oh, I think Sam may have cut out for a second here. So just one moment, please. I think we can begin our question and answer round with a question from Sunil Fool.
Good afternoon, ma'am. How are you?
Very good. Nice to hear your voice. Go ahead.
Thank you, Danielle. Danielle, I just have a quick question. Like, as the crime rate is increasing in Edmonton and Calgary, right? We always talk about the mental health of the person who's involved in committing. but we never talk about the person who is on the other side, the mental health issues, what the family go through as a victim, right? Or the person has gone through. No one talks about it, what their needs are, what even in the justice system, no one care about that. No one talks about it. Media doesn't talk about it. Do you have any thoughts, like when we are talking about so much mental health, they need some support too?
Yeah, it's a really good point, because when addiction or mental health issues strike a family, everybody is impacted by it. We do have counseling services. I'd mentioned that through 211, so that if there is any family member who needs to have additional support so they can talk through what they're going through, 211 is available to everyone. And so we want to make sure that as we're getting people on the road to recovery, that the entire family unit is able to be healed. But it's the approach that we're taking with our recovery communities is building recovery capacity, and that's getting a person clean, giving them education and support so that they can learn a new skill, learn how to take care of themselves, reconnect with family and friends, be able to get a job when they get out. Because when you can build all of that capacity up again, it just gets them back on a road to recovery. So that's the approach that we're taking. When it comes to the, does that address your question, or was there more?
Yeah, no, it's just like, like especially like when even a justice system, the crime happened, they always, say the person committed the crime because of the mental health, but they never said, okay, what happened to the victim now? Like, he has to go through the same issue too. What is the long-term impact on the
Right.
kid's wife? If we can address that also in a justice system.
So we've got Victim Services, which is a funding entity that helps to provide support for the victims of crime. And that would include victims of crime caused by whether it's mental health or some other reason. We're in the process of trying to make that more accessible, because it was only available in 60 communities, and we've got 355 communities in Alberta. And so we're about to move down a pathway of regionalizing. And I've asked Mike Ellis to make sure that we're regionalizing in the right way to make it more accessible. I think that there are maybe some modifications that we can make there, but we do fund victim services through I think it's revenues that are derived from some of the ticket revenue that comes in. So we're committed to continuing to do that and to expand the services. It's very important if people are going to get over the trauma.
Thank you, ma'am. I appreciate it.
You're welcome. Thanks, Sunny.